Spend a day with me as a PhD student in cardiology rotation. This rotation was literally one of my favorite rotations so far. And the reason why it was my favorite is because I got to see a lot of the topics that I would see in class last year. And for me to be able to see it presenting on like an actual patient was like really educational for me. So some of the patients we saw, they would come in with presenting with signs and symptoms of a heart attack. So we would literally send them to the cardiac cath lab and they would get the procedure. It's called cardiac catheterization. This is where it's like an invasive procedure to diagnose and treat heart conditions. So I got to go to the cardiac cath lab and observe and shadow. We would see which coronary arteries are blocked, and then the provider would decide whether to stent the patient or if the patient needed a CABG procedure, which is more invasive surgery. My other favorite topics were learning about heart failure and seeing all the signs and symptoms of that. A lot of the patients also had atrial fibrillation, atrial flutter, so I got to see cardioversion and the overall management of AFib and atrial flutter. I also enjoyed giving patient education and learning their bodies, because if you're having chest pain, you have to go to the ER, especially if you've been having chest pain for a few months. Go seek medical attention. Along with shortness of breath, those are all things that you should go to the emergency room for, because you never know if you could be having a heart attack. But there are other risk factors for having a heart attack, and I can talk those in my other video. Thank you. Bye.